Let's talk singing.
Hi, Lucy. Good morning.
Hi, Anna. Nice to meet you here in
Nice
the
to see
internet.
Yeah, nice to see you too. How are you? You good?
Yeah, I'm fine. I already said I'm a little excited because we're speaking English today, and this is not my mother language. I'm Deutsch. But yes, I think it could be very cool.
Yeah.
It is very specific team or specific terms to
Yeah.
talk about. Yes, let's see how it goes.
Yeah, exactly. I'm excited as well because I'm hoping, how we know each other. So I guess maybe we should start off with that because
Yeah.
it was like maybe 2.5 years ago, I guess, or 2 years ago, maybe, right?
Yes,
How old is your child now?
nearly 2 years, 20 months.
There you go.
Yeah,
Exactly. Right. So you work in the music school here in Magdeburg and Sudenburg. And so 2 years ago, I got the opportunity to come and replace you for your time of your maternity leave. And so I got most of your students, I think, right? Most of the people that you had.
yeah,
And it was great because I got to sit in on one class. You can remember this, I think, with Sophia, maybe, or maybe a couple of people.
yeah,
And I
yeah,
sat in there and I watched you and took
yeah.
class, and I took loads of notes because at that point my German was so bad, and I had no idea of phrases and words that you might need in singing class. So I
Oh, really?
remember my notebook was full of these words that you used, and I think I'm still I'm still of course I'm still using them now to this day. So that was a
Good.
big help. That was really nice.
Great. Wow. I didn't think of that because I thought you had a really good German at that time.
Mm,
So, yeah, but
not
it's
nice.
maybe another, yes, surrounding with those words.
Yeah, exactly. Words that I guess when I was speaking German back then, it was more Umgangssprache, as in like more
Yeah,
like talking with people,
also.
like slang kind of thing. And then,
Yeah,
as you said, really specific terms that are really needed for singing class, so you can actually
yeah,
explain to people what they need to know.
right.
But yeah, so that was that. And so, Lucy, maybe you want to tell me and tell people that are going to watch a small bit about, yeah, kind of who you are, like what you do,
Mhm.
your job, and also, yeah, maybe what, also like not just your job, but maybe you as a performer and as a singer and as a teacher. Maybe you just want to give us a small introduction. That would be great.
Yeah.
Yeah.
Okay. So I'm Lucie from Magdeburg. Yes, I have some notes here, so
Yeah.
maybe sometimes
That's no problem.
on the paper. Yeah. I'm 28 years old, and here in Magdeburg, I work as a logopädin, which is like I think in English a speech language pathologist or therapist. Yeah,
Exactly.
I
Yeah.
think it's the same. Yes, and singing was always there in my life. So I sing from childhood on with my mother. And yeah, I think like when I was around 10 years old, it got a little more professional. I got my first singing lessons and I was in a choir here in Magdeburg. It's a children's choir, and yeah, it's also quite a professional choir.
Mhm.
We had lots of classes with musical profile in school and music theory and ear training and choral singing, of course, voice training, competitions, valuation singing. And yes, that was very cool and fun and also a bit of pressure
Mm.
on my voice.
Mm.
Yes, and that was it. With 15 years, I got very bad vocal problems. And yeah, there were a lot of causes like mutation, is that
Mm-hmm.
right? I think,
Yeah.
yeah, mutation,
Yeah.
vocal changes. And yeah, of course, an inadequate singing technique at this point. I didn't have a teacher who gave me what I needed at the moment. And I also had enlarged tonsils and nasality, a lot of braces in my mouth, yes, which is something for aim and makes articulation very bad. So it was a very low point in my life. And now I would say a big opportunity for me, because I could learn a lot of, a lot about my voice and how it works and how bad it can be, but also that it can get better, because I had then therapy, of course, and I was at the doctor with the laryngoscopy and a lot of diagnosis. And yes, I couldn't sing that good then. Yeah, it was very hard, but it got better, and I learned something about logopedin. And yeah, there was a wish to maybe do it later when I'm grown up and to learn about that. Yeah, and I did.
Yeah. And so
Yeah,
that experience kind of pushed you towards kind of thinking that people that do have damage, you can get better. And I guess maybe then you had this view of
yeah,
like, wow, if I can get that, maybe it'll be nice to be able to do that for other people.
yes, yes. And there was also a big anger, I think, inside me,
Mm.
because I thought, I'm in a kind of professional choir, and why wasn't there someone who took care of me and my voice,
Yeah. Yeah.
who heard that I had problems and who could help me before it got that worse, actually. And
Absolutely.
yeah, I was very angry, and I also told that, and I hope that now they are a little, they changed their work with the children, because there are children voices, kids voices. And yeah, the damage was very big for me.
Yeah. And
Yeah.
I guess it's so important, for now, for people that work with kids, especially teaching
Yeah,
them singing, that you have to have some sort of knowledge about
yeah,
how it actually should work, not just using scales and using techniques that have just been kind of
yeah,
handed to you from the classical
yeah,
world or the choral world. We kind of have to think a small bit more scientifically about how, when we
yes,
come into problems like you had, like, what did you say,
yes.
you were 15 when you had some problems? That's such a
Mm.
hard age to have sung for 5 years and also sung with
Yeah,
your mum, and that
yeah,
psychological thing of kind of, now I can't and something is wrong,
yeah,
and then
yeah,
not being able to have kind of faith or trust in the choir that you were with. But okay, so when you got older, then so okay, so you went through some vocal problems. You went to then therapy for to help that, and you got the laryngoscopy. And then when did things start to get a bit better? When did things start to become more like your old voice, or did
yeah.
it wasn't a new voice?
Yeah, it. I think now it was a big change for my voice, and maybe it also was not that long. It didn't take that long, I think. Maybe 1 year, and I got a good speech language pathologist and a new singing trainer, new vocal coach, which I really liked, and she was great. She taught me everything from
Mm.
the beginning, and I got new feelings, and I got these overwhelming situations in vocal coaching. I think, oh, this is my voice. Oh my god, I can do sounds like this. Yeah, what
Cool.
I now try to give other people too. And yes, that was great. That was enthusiastic and very cool. Yeah.
Mm. Yeah.
Yeah.
And
Mhm.
what was the vocal coach that you had she was she a reference from your speech therapist or speech pathologist? Was she kind of someone that the speech pathologist said you should go to her?
No, she was actually, it was Mimi, and Mimi was a singing teacher at the music school in Sundborg.
Ah, nice, cool.
Yes, yes. And she studied in Magdeburg. At that time, could study, you could have studied music in Magdeburg,
Mm,
which is now over.
such a pity.
And
Yeah.
yeah, yeah.
Mm.
Really. And yeah, she was very cool, and she taught me the Swedish Italian singing technique. So this is quite
Sweden?
classical. Swedish Italian,
Okay, right.
the canto, but in a
Oh, right.
very
Okay.
functional way.
Mm.
Yeah, and yeah, with her I did more solo singing and more. like popular music because I found my own voice, not that choir voice where you want to sound like all the others, where a lot of people are one voice. And I found my own voice, and yeah, that was my first experience also with other musicians in bands or something like that.
And so you then started playing in bands, yeah? So
Yeah, a little bit, yeah, with other musicians.
cool. And what kind of music did you start singing? What was your go-to?
Yeah, quite pop rock music like
Cool.
this. Yeah.
Good. Great.
Yeah.
And so, okay, so then let's talk a small bit about what exactly a speech language pathologist does.
Yeah. So I think in 2011 I went to Leipzig, and in Leipzig is a private school for logopedy. You have to pay for, and in 3 years you can get yes the exam for logopedin. And I have a definition, and I can read it maybe because
Yeah.
it's in English.
Yeah.
Speech language pathology or logopedics is both a scientific domain and an autonomous profession. As a science, it is the intersection of medical, linguistics, educational, and psychological sciences and focuses on etiology, assessment, and intervention of communication and swallowing disorders. Yeah,
Wow.
and the assessment includes screening, identification, evaluation, and diagnosis. And yeah, the intervention is, well, prevention, counseling, treatment, consultation, management, and education. Yeah, all that stuff.
Okay. So really when the speech, that's great, by the way. That's so cool. Thank you for that definition. Great. And so really when you think of speech and language pathology, you think of people that have problems, right? People go to speech language pathologists when they have problems with their voice, when they realize that there is something not working or some sort of difficulty that they have.
Yes,
Yeah.
right.
And
Yeah,
yeah.
and first they were at the doctors, I think so, at
Right.
the ENT, or what is it in English?
Yeah, ENT, ear, throat, nose,
ENT?
yeah. Or
Mostly the ENT.
ear,
Yeah,
nose, throat doctor, yeah.
right. Yeah.
Yeah. And what's it
Yeah.
in German? No, what?
Hals, Nasen, Ohren,
Oh, yeah,
Arzt.
has an as an oral. Yeah, that's
Nearly the same.
yeah, basically, yeah.
Yeah.
And so, but people come from two sides. So there's singers that go when they have a problem, but there's also people that have problems, as you said, like as you said when you were younger with braces and how that affects articulation. And you also said in the definition about people that have problems swallowing.
Right. Yeah.
Right, so
Yeah.
these are also not just with singers, but with speakers and people that just have problems
Yes.
with
So
going on.
nearly with everyone, children and adults.
Yeah.
And I also have some notes because there are a lot of disorders we work with, like speech development disorders, late talker, articulation disorders, speech flow disorders, myofunctional disorders, auditory processing and perception disorders, yeah, swallowing and voice disorders. And yeah, nearly the same with the adults. There's also that dysphagia, the swallowing disorders, and dysarthria, and speech apraxia and aphasia. Yeah, aphasia.
Wow.
Where you have maybe no words, and we help them to get their words back.
Right. Yeah. And so with this kind of with helping someone get their speech back, what kind of methods do you use? What are the things that you know the big question. I mean, I know it could be such a huge
Yes, it is.
point, but what are the kind of most used maybe methods of getting someone's speech back or yeah.
Someone's speech back. So you always have to look at the causes at the beginning in yes, the diagnosis, and there are various causes like general development disorders or disabilities, syndromes, disease consequences, strokes or accidents. So you have to look, what are the resources the people have? What can you work with? And there are a lot of methods. So you have to learn different things, not just in the education. You have 3 years to become that speech language pathologist. The most part is afterwards, where you search your profession. So not every speech language pathologist does everything, which is also important. I think that you have things where you can say, yeah, I'm good in this and I do this and I can help people, and other things can other SLPs do. Yeah. And the main thing is to help them to live a life worth living and to participate. Yeah, and you can do everything. So if you want to know something concrete with aphasia, you can train words, you can train with them getting back sentences or getting back communication strategies. No, strategies.
Yeah, that's it. Yeah.
The tragedy. Yes, and just to help them get those methods in basic communication in the everyday life. Yeah.
And does that mainly come from a psychological point of view of getting someone's confidence up to use their voice, or is there something that you work with technically and what's happening inside?
Do you mean with voice patients or?
Yeah, with voice patients, I guess. Yeah.
There it's all of it. So psychological techniques, but also just the functional techniques, the functional work with the structures and muscles and the training in it. Yeah, I think I have also a little bit of that in my notes. But I don't know if we switch to voice therapy and voice training, or if
Yeah, maybe we stay. Yeah, let's stay with the singing, right?
yeah.
Yeah. So, but I guess what's really important is that people that speak and sing, we forget that this is something we just learned as a child, and it was a function that we just had, and we just spoke and mimicked and made sounds and learned how to use our tongue and but when you have to go back and let's say let's take an example maybe of a singer who maybe, and you can tell me if this won't be a topic, but maybe a singer after an operation.
Yeah.
Right, so a singer goes and has an operation on their throat, and maybe they had nodules or polyps or a hemorrhaging or something didn't work or something happened. And afterwards, how does one get back into finding where their voice is and how they can function again?
So like in the beginning, they come to me or they come to us in our practice.
Practice?
Yeah,
Mm-hmm.
practice. Yeah, and we speak a lot about their problems and about the things that don't work and they want to get back, or what they want to achieve. Yeah, and what their goals are. So this is the most important thing. What does the patient or the client, what does he or she wants to get back? And after that we make some tests, like reading a text, and also do loud sounds, do quiet sounds, a lot of tones. And we look what are the functional problems, where are, like, which structures don't work, which structures have to be improved maybe or trained. And I make a plan for them with specific exercises and specific therapy, and we go that way together and look what we will experience together. So
Hmm.
it's always like a little riser vacation. No, not vacation. What to say? A way,
A path,
a
maybe?
path. Yeah, a path. We go
Mhm. Or a
together.
journey? Reise, yeah, sorry, journey.
Yeah.
Yeah,
A journey. Yes.
yeah, yeah. And so when you're listening, when you're doing this exam with someone and they're reading out a text or you're finding where the function isn't working,
Yeah.
yeah, you have something there?
You mean the text or what?
No, I thought you were putting something else. Yes, I have a
Just
text
that,
here.
just one minute.
Um, but are you using your obviously with your training in the 3 years in Leipzig, you really you're listening for things, right? You're listening
Yeah.
for
Yeah.
for dysfunction,
Yes,
right?
I'm listening.
Yeah,
Yes.
sure. Yeah.
Maybe I have something I can show. This is something I learned in an extra course or workshop
Okay. Mm-hmm.
with Stephanie Kruse from Munich. I want to
Recommend?
recommend her. Yes, because she's very cool. She also has Instagram, and yes, I learned
Stephanie
Stephanie. Yes, Stephanie Kruse.
Kruse. Okay.
Mhm. She's also an SLP, and she is from the LAX VOX Institute here in Germany.
Super.
So she does this, and she's an EVT constructor as the voice technique.
Wow.
Yes. And I use something she gave me. One moment,
Mm.
please. This is, yeah. So I can show you like basically from the EVT, but this is like a paper of diagnosis
Mm.
where are different structures there. So
Wow.
the true vocal folds, the false vocal folds. I have it in English here. And I can make my notes, what I'm hearing while the patient is reading or speaking, and I just make a cross. It's maybe here the true vocal folds. It's
Mm.
glotta. I make yes cross here, or it's stiff, or it's a thin true vocal folds. Yeah, and this is a very cool system because I just hear what I'm hearing, and I make my notes, and then we try to talk about that, what I heard, what the person experienced, and we can think about what we want to change or what could be different. And so it's a very basically technical work with
Right.
that.
Yeah.
Yeah.
And also you can, as you hear, you're ticking the boxes and you can then build up a profile of what you can then work with.
Yes. Yes. Yeah. For example, I'm hearing, yeah, this is a big theme. False vocal folds are working with or helping. Yeah, they're always helping. They want to help, and that can be quite exhausting when you speak all the time like this, and a lot of people do. And yeah, so I show my patient, yeah, look, I educate them. These are your false vocal folds, and they want to help you, but it's not maybe that good to do this, or it's not that the right way. So we try to let them go, to relax them, and to train the we call it the lower pressure valve, you
Mm.
know,
The lower.
double.
Mm-hmm.
Yeah, it's a valve here in the larynx. It's a double valve system,
Okay.
and the false vocal folds are like the pressure valve, with a lot of pressure, and the glottis is more the lower pressure valve. Which,
Okay.
yeah,
Yeah.
and we want to train this with special exercises.
And
Yeah,
could you explain maybe or maybe show where the false vocal cords are or false vocal folds?
yeah. Maybe we can. I
Yeah,
hope we can see it here.
you might be able to see.
Might be able. Yes. You can look into our larynx, and there you see these thin white things are the true vocal folds. So our living instrument, and there is some mucosa above them, and these are the false vocal folds. And when they are relaxed, you don't see them in the laryngoscopy while making tones. But often when you make this sound with a lot of pressure, they nearly are so active that you can't see the true vocal folds anymore. So you just see the false vocal cords.
Wow.
Yeah, this is very, yeah, if you see it in an Untersuchung,
Untersuchung? An examination maybe, or?
yeah, okay, yeah, by ENT, yes, when he
Mhm.
does it and you see it on the screen, it's very beeindruckend.
Beeindruckend is impressive? No.
Yeah, yeah, I think
Yeah.
it's impressive.
Yeah.
Yes, yeah.
I've seen many of those things, especially from the CVT Research website,
Okay.
from Kathleen Sadlin and stuff, and they show the laryngoscopy, and there's many things on YouTube, but
Yeah.
I've always been very unsure of where to look for the false vocal cords. I can see the real vocal cords, I can see the thyroid arytenoid muscle, I can see all the cartilages, I can see the arytenoid, but then sometimes I just don't know where to look for the false vocal cords. So that's,
Yeah.
as you said,
And,
the mucosa over, right? That's really what you're looking for.
yeah, and I think it's good when you have to search for them because it means they are not that active. Yeah. So
Right. Okay.
yes,
And
when
then,
you,
Mhm.
yeah, no, ask.
I
No,
was
you
just
ask.
going to say, and then what, I guess what is the point of the false vocal cords then? Why are they there?
Well, so that like I hope it's right that pressure valve
Hmm.
is very important for your physical stability. So when you do things, they are also like they save your trachea, your
Trachea. Yeah.
yes, they
Trachea,
save,
trachea. Yeah, nice.
yeah,
Uh-huh.
right. So that no foreign stuff can go there and you
Right.
can
Right.
aspirate. Yeah. So that is their main function, and also they close when you have to like press.
Yeah, yeah.
Sometimes maybe everyone, yeah, we need it. It's very important. Yeah,
Exactly.
and it's not to unterschätzen.
Unterschätzen. To underschätzen, I thought was appreciate.
Unterschätzen, translator.
I got it here. Underestimate.
Underestimate, right? Because there are people who have, because of cancer, who don't have a larynx anymore. Did you hear of that?
No, I've never heard of
Laryngectomy?
that.
No. And it's it's not that bad. So you can live with that today. There are very good surgeries, but if you don't have the possibility to make that pressure, to have that pressure valve, you have difficulties to press or to like tragen,
Hold?
hold, yeah, like hold heavy things.
Yeah.
Yeah, you need that to
Carry.
do this or to do like sports or
Yeah.
something.
Yeah.
We use it every day for the stability in our thorax.
Yeah.
Yeah.
Mm. Wow.
So yeah.
Yeah. And so, okay, so then, so as I think what you're talking about also is this subglottal pressure, right? Of the pressure coming up to the vocal folds and that feeling of is
Mm-hmm.
just the vocal
Yeah.
folds going across. But now you're kind of saying also the false vocal folds come into play as well in
Yes.
that
Yes.
subglottal
That
pressure.
yes, it's their main function. Why?
Okay.
Yes.
Yeah. Okay.
And sometimes it can be also something we want to achieve if there are people who also don't have the true vocal folds.
Right.
So because of surgery, like there was cancer or there are so big growths
Yeah.
on the glottis,
Mm.
it can be that the whole glottis, the true vocal folds are away. Yeah, you don't have them anymore. So
Mm.
you don't have no voice and you can make like an ersatz, a new voice with
Mm.
the fourth vocal folds. So
Wow.
you train them to press together to even have like a voice. And
Right.
you
To create some sort of phonation that you have some sort
right,
of sound. Yeah.
That's right. Yeah.
And so, okay, so then let's take that point and move on to people that want to use this technique of false vocal cords or false vocal folds in their singing.
Hmm.
When people want to learn how to do this technique, what kind of singing needs false vocal fold action?
Yeah. Maybe I'm not that good in it because my techniques is that I don't use them that much. I personally can't use them that much. It makes that vocal fatigue, and I don't like it that much. But I think, yeah, like in rock singing or something like this, where you want a lot of effects or distortion with your voice, yeah, you can really use it, but maybe not all the time. Just very sparsam, very
Yeah, sporadically or not so often. Yeah.
yes.
Yeah.
Because for me personally, it is also not that cool when I hear it all the time, when
Yeah.
a singer does it all the time. So it's just interesting sometimes and very, very, like you said, yeah.
Yeah, right, exactly. You don't want to hear it all the time because it takes away from the effect then.
Yeah, yeah.
Yeah.
For me, it's like with belting or other things. Yeah, I personally like if it's very if the singer thinks about when to use it and shows what what he can and what he learned, but doesn't do it all the time.
Yeah,
Yeah.
uses it as an effect and uses it
Yeah.
as a moment in the song. Yeah.
Yeah. Right.
And so, with all the knowledge that you have and you working as a speech language pathologist, how has that helped you when because you're also a singing teacher,
Yeah. Hmm.
right? So, how has that helped you? What, I'm asking because at the moment, this is such a huge topic for people singing teachers to not just be singing teachers anymore, but really to try and understand what's going on inside, and like that, hearing things and using your ear to kind of realize that, okay, that's what I hear. I hear a false vocal fold happening, and I don't think that's very healthy for this person all the time, or I hear a certain pressure that maybe shouldn't be there. Has that helped you as a singing teacher?
Yes. Yes. Very much. Um, Yeah, because learning just the basics and of anatomy and physiology or even pathology, that made a huge difference. And I could learn the concrete functional processes and their structures and their muscles, and um, could better understand or get to know my own instrument. Because yeah, it's a living instrument, so I have to know about that. I think it is just so important, so really, really important, and that improved my personal technique, and so even my technique with working with singers or with those students who want to learn even the basics, and even for the basics it's so important to have that knowledge, that anatomy knowledge, and yeah.
Yeah.
Hmm. Yes, and yeah, my other point was that I know a lot of bad things can happen to your voice, and I learned that there are usually solutions and ways out, and a lot of opportunities if you have that knowledge about anatomy and physiology, and also that creativity and just positive look of things, or positive mind
Yeah.
to with it. Yeah.
Yeah. And I'm sure your students, I guess, something I also talked about with other people on the series that I have.
Yeah.
I've talked also about this thing of using language with students that isn't overusing so that they get a bit scared, like making it so that you're using language that they understand.
Yeah,
And
this is also very important to
yeah.
me. Um, I wrote something down.
Hmm.
Um, yes, I wrote that I also learned good communication strategies or and questioning techniques, And I think it's very, very important to ask questions. So yeah, even my whole therapeutic process or the teaching process is about asking questions and not telling them something. So I ask and they can tell it by themselves, or you know, that's the
Yeah,
way. Yeah, and that's a lot. Yeah, it's a lot more effective when you want to learn something and to feel your own feelings and not that suggestive thing from the teacher or
right. Because I guess some students can come out with some things that really they can relate to and mean
yeah,
something to them, which is
yes,
actually probably better than you trying to tell them, oh, that's actually your this muscle connecting to this muscle, and this is what's happening, which you
yeah,
can do if they ask for that, I guess.
right,
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 yeah, I know.
yes,
So, which is important to be able to explain to them, but also, as you said, to be able to just allow them to find their own related terms or feelings to be able to express them. And, but as a
yes,
teacher, then we need to have this information behind
yes,
us to kind of go, yeah, but actually, if you're feeling that, maybe we need to do this.
mm-hmm,
Or,
mm-hmm.
yeah, you know.
Yeah, yeah, or questions like, okay, that sounded like this. Maybe it can also sound like this. Do you want to try it?
Mhm.
Or how do you want to sound it? Or what do you want to feel? What are the feelings you want to have? Yeah,
That's nice. Yeah.
yeah, that's very cool.
Yeah,
Yeah,
and handing the kind of the, the the power over to the students so that they can feel that they're getting as much as enough out of the lesson as possible.
yeah,
Yeah.
yeah, right. Yeah. And sometimes you have a point while teaching and they come every week and you do your exercise and trainings, and sometimes they don't know what their goals are or what they want to achieve, like in a longer time.
Yeah.
And if you ask them, yeah, think of our summer party, which we don't have this year,
Yeah, I know it's
but think of that. What could you imagine? What will you do there? What are you going to sing? How will it be with the other musicians? And then you can give them yes, some things to think about and to think about themselves as a musician or as a singer or about their own technique. And yeah,
yeah,
mm,
setting them a goal and kind of saying we will work together to get to that goal.
yeah, yeah, I'm there for you, and we
Mm.
can do everything you want, but you don't have to do things you don't want or you don't like, just to have that Vertrauen.
The trust.
Yes, yeah,
Mm.
that trust and that safe space
Mm.
together, because it's so intimate. Yeah,
Mm.
an intimate situation. I think it's working with voice is working with their own personality. Like, yeah,
I
it
do.
can be, there's so much emotion, so many emotions there.
Mm. Mm.
Oh, yeah.
I know. And I love those moments in class when you have a student and they break through something and there's a real sense of release for them.
Yeah,
And
yeah.
I'm not I mean, I'm sure there's many other places that one can go to find that, maybe sport or yoga, things like
Mm,
that, of course, but there's something very special about being in a room with someone, having that half an hour or 45 minutes, and not always breaking through, but when you do break through, this sense of yeah, as I said, release and beauty and sometimes sadness, but not sad that you broke through, but realizing maybe that you do think about something that brings you some pain, or
mm.
it's very
Yeah,
beautiful. Yeah.
yeah, yeah. And yes, I think this is something which you as a teacher or as a therapist, you can learn a bit, but it's also your own personality or your character or mental things you just have to have and to want. So it's
Yeah.
not something everybody has, and it's also not important that everybody does that, because there are students who don't want to work like this with voice, which is okay. But I think it's the most effective way to change something and to learn something and to work with voice for your whole life.
Yes,
Yeah.
absolutely. Yeah, I remember there was one time when I was when I maybe I was 9 years old or so, and we used to sing in class in school. We used to sing every Wednesday, or actually probably every day, but there was always a special time on a Wednesday that we
Okay.
used to all sing together, and it was, I don't know, some songs about Joseph and Mary, or some songs about Peter and Paul, or whatever it was. And I remember coming in one day, and when I was younger, I actually, and this is something I need to do. I need to go and get a laryngoscopy examination, because when I was younger, there's a lot of videos of me speaking like this, like when I was like 4 years old, having
Okay.
it's very crazy, it's very freaky, and I can't ever remember experiencing it. I can't ever remember being that young and thinking my voice hurts, or I can't ever remember that. But videos show that I spoke with this very, very, like, nearly like a vocal fry
Okay.
sound, which was very strange. But then there was one time when I was 9 years old that we were singing in the class, and I came in and I couldn't sing. And yeah, and it was this thing of feeling that there was no sound coming out, there was nothing. And I remember crying for so long, and also going to my teacher and crying, and she didn't understand why. She didn't understand, she kind of said, "Oh, I'm sure that's very sad." But for me, it was like my world was kind of going, "What? What do I
Yeah.
do now? I can't sing. What if I can't sing tomorrow?" This kind of feeling. And this is what I mean when getting back to like students that maybe have some problems, or how intimate it is with a student with singing, that it's something that is uh, doesn't happen in many other places, and you have to be very careful and very sensitive to singers and their emotions and their goals, as you said. But also, why I really love talking to you about this is because I think that more and more singing teachers need this kind of background information to kind of not just push someone because they've been told that that's the technique, but
Yeah.
actually listen to them and help them.
Right. I
Yeah,
think it's really damn important to have
yeah,
that knowledge.
yeah,
Yeah. Yeah. That's right.
yeah,
Um,
yeah.
yeah.
I was
Yes.
gonna, yeah, go on. Mm-hmm, mm-hmm,
Oh, I just had one
mm-hmm.
point because, yeah, I already taught that living instrument, and to know how it works is essential because it's not that easy to replace it. That instrument, yeah, it's not like you're buying a new guitar or something like this,
Yeah,
and also repairing it can be very complex, and sometimes you don't get back your voice you had before.
right.
So with me, it's the same. Um, I love that it is like this, but I think I would have another voice now if I didn't have that problems, which is positive and negative in both ways. But
Yeah, yeah.
I actually more like it because I have something. It's something personal in my voice. Something. Mm, what's the right word?
Mm.
Like I don't know.
Maybe I'm thinking, maybe like it's like a point of reference that you can kind of
Yeah,
reference back to. At that point something did change and you worked from that.
yeah. And you always hear that I had problems sometimes. Also you hear it when I'm singing. It's a special sound, I think.
Okay, is it a
Because
distortion? Is it like a natural distortion sound, or a?
yeah, sometimes it is.
Yeah,
Yes,
yeah.
just on my true vocal folds,
Yeah.
like little Narben, little Narben,
Now,
Narben.
um,
Mm,
would that be, um, are they blisters? Narben?
maybe like mhm,
Hubs.
yeah, yeah,
Narben hubs. Hmm.
no, scars,
Stars. Ah,
scars,
okay. Okay.
like scars,
Yeah.
because there were little growths and they aren't there anymore, but they have been there, and sometimes we hear that there's something different just in the
Right.
sound. Yeah,
Yeah.
but
Yeah.
it's unique. That was the word I
Hmm.
needed.
Nice.
Unique, you know?
Yeah.
Yeah,
That's nice. Yeah, it's a unique,
yeah,
exactly. Yeah. Yeah, because you have this, like if someone has a scar on their body,
Yes.
they're very unique, and that's, you know, that's just going to be there for the rest of your life.
Yeah.
And you
Yeah.
also inside have a scar on
Really.
tissues, and
Yes.
so that's going to be make your voice unique.
Yes. And this is also something I want to tell people,
Yeah.
that it isn't that you don't have to be scared of these things that can happen to your voice, because it can always be something which makes your voice unique.
Wow.
Yeah.
That's really interesting, because that's actually the nicest way to think about getting vocal problems. Because a lot of people, you're completely right. People are terrified of doing something wrong and breaking something, and of course you should be not scared, but you should be wary and careful. But I think that's a nice thing to think about, is that if it does happen to you,
Yeah.
to not think that my voice is bad now, but maybe it's just more unique.
Yeah. Right.
I love that. That's great.
Cool.
So I guess last two questions for you. Um,
Yeah.
what resources would you recommend people engage with? Which is
Okay.
a really, really interesting thing for people to learn more. People maybe don't have the chance to go and study 3 years, so maybe they want to find something on the internet or go and do a small course. Do you have some ideas?
Yeah. So me personally, I like to have some good books. And I work with, like, these are German books, but Die Sängerstimme, Seidner Wendland, like such a basic book. Or what I work with is
Mm-hmm.
functional voice therapy, functional voice pedagogy.
Mm-hmm.
Um, there's a book, Lieber Schüler, lieber Lehrer, lieber Lehrer, lieber Schüler.
Well,
Rabbiner, it's a Rabbiner method.
Rabina method? I don't know. No.
It's even the functional thing.
Okay.
And yeah, what helped me a lot personally, like small courses or workshops or training courses you can do, is the LAX VOX. You
Mm.
know?
We'll both check out our LAX VOXes.
Yes. I think you have one too,
I
Connor.
do, I do. It's from you, a very nice present.
So yes, it's some of the best methods I learned and I use, and I like to use it every day, and I can do so many things with it. It's just cool. Yeah.
Wow.
So this is LexVox, and like if you want, what I would really recommend every teacher or therapist, get yourself methods or concepts you like to work with, you learn, and you can, yeah, where you have a system to work with. Yeah. And something I like is, and I did level 1 and 2 from the universal voice system. This is from,
Universal voice system. Okay, very
yes,
cool.
it's quite new, I think. It's from Alberto Terdus, Netherlands. So this is a universal voice guide. It's an older one. I'm waiting. I'm very curious about the German version. It will come maybe this year. The Stephanie Kruse does the translation, so I'm waiting. Universal voice system. He put a lot of things of a lot of methods in this word together to a very easy voice system, and it's so cool to work with that.
Very
Really.
cool.
So EVT, CVT, bel canto, speech level singing. Yes, he can all of this. So he's a very, yeah, a very professional and a very cool guy. And yeah, I hope I can get the possibility to learn more of him, to have another course with him. But level 1, level 2 of this system was quite cool.
And
And
did
yeah, yeah,
did you do this online, or did you do this in a person-to-person workshop?
in a person-to-person workshop in
Okay.
Cologne.
Okay.
Yeah,
In Cologne.
in
Okay.
Cologne.
Okay.
Yes.
Wow. Fantastic.
Yeah,
And
that
are
was
there? And I guess there's a website, and people can go on and check it out. And
it.
yeah.
It's in Amsterdam. In Amsterdam, there is the Universal Voice Institute, where you can also get lessons or courses and
Very cool.
also the course for the universal voice instructor. So it's like a long-term education, which I think is very cool.
Great. Excellent.
Yeah. Yeah, right.
Super. Yeah. And so, okay, so last question, Lucy.
Yeah. Woo.
Yeah, this has been so good, by the way. It's been really, and I know this is not your mother tongue in English, but I really appreciate you doing this. And
I'm quite proud.
yeah, you should be really proud, actually. Okay, so what are the favorite? I'm asking this to everyone, because I guess it's always interesting for me to know, and also for other people to know of what are your favorite go-to warm-ups that you generally use.
Yes. So I thought about that, and I thought that at the moment, now at this time, my exercises have to be light and intuitive and not that complex. Because, as I said, I have a toddler at home, and I don't have the time for longer exercises and stuff. And I really like to do those classical exercises, like big tones and very loud. And she's a bit frightened of it. So I have to search for myself some more light exercises. And I love any yawning I do with everyone, yawning all the time. Just the free one or tone series. All the time we yawn because we have that big throat and that larynx which is lower, which is quite relaxing. Yeah, that yawning. Yeah, that just puts me in a relaxed tone. Yes, of course, LAX VOX. I do all the time. I can do it with my baby, and she also likes it, and we're together. And yeah, with LAX VOX, it's very a go-to exercise because you can do everything with it, really everything. Just yeah, tones, scales, or you can try words with it. You can yeah, like bubbling whole songs or just parts, and then sing and bubbling, and it's yeah, there are various possibilities what you can do with that cool tube here. Yeah, and what I really like is everything towards twang, actually, because this is a sound that makes me awake, you know.
Twang, right. Yeah, yeah.
And yes, I can create a cool penetrating sound. I wrote down because it is really penetrating with little effort, and this is just cool. And I use like animalisms like all the time. Meow, 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 meow. And
And
yes,
it's
this is
instant right there. As you said,
yes,
penetrating. It just boom.
yes,
Yeah.
yes, right. This is also an exercise which a lot of my students learn to love. At first, they think, "What the hell is this? Why do I have to learn this? It sounds like not like shit, but it sounds this is not my
Yeah.
voice."
Yeah.
But the voice immediately becomes brighter, and they learn that it makes fun and that the voice is more brilliant, and you can like sing yeah, with less effort. And yes, that's it. So these are my exercises I thought I would take on an auf eine einsame Insel mitnehmen, on a lonely island.
A deserted island.
Yes, deserted island. Okay.
Excellent. That's great. Yeah, but I mean, that's so good because I guess this is also the thing that when you tell students to do an exercise and they kind of go, "What? What are you making me do?" But
Yeah.
then there's always method to the madness or reason to the madness. Yeah, or like, why it sounds pretty crazy, as you said, with the twang, getting up into that kind of, yeah, as you did, like animal sounds or like that cackling witch, that kind of
Yeah.
thing.
Yeah.
There's always this thing of there's reason for it, as you
Right.
said, brightens the tone immediately and without so much pressure, without so much energy, and creating a sound that can penetrate and that can be used, as you said, like can be used in places
Yes.
you want it to
Yes.
be used. Yeah.
Yeah. And it's always strange at the first time, but second time, third time, they become used to it and they're gonna love it, all
Yeah,
of them.
yeah,
Yeah.
yeah. And very, very, very shortly, very quickly, can you just, and maybe it's going to be hard to put it in very short, but the reason for the lax vox
Okay, the reason for the, you
is
mean why it is so cool?
maybe a
What?
good, yeah, I've been trying to explain it, and also I use the straw exercises, a lot of SOVTs and things like that, but I also use the lax vox, and there's vocal tubes, and it's for rehabilitation, but a lot of people, even though it's enjoyable to do, and I've tried to explain it, sometimes
Yeah.
I feel that I can't really convince people sometimes
Okay.
of the use of it or the benefit of it.
Yeah, okay. So if you want like a very professional and good shortly video, something like this, go to the LAX VOX website. Yeah, LAXVOX.de. There's Stephanie Kruse and Thomas Larscheid from Germany, who did a very, very good job. And they also make courses. But even on the website, you can learn a lot how it works and what the benefits are. But as I can say, the tube is very cool. It's flexible. The length is like your vocal tract and your trachea to your lungs. Yeah, it's nearly that length. And also the, what is Durchmesser, Connor?
The circumference.
Yeah, okay, that
Mhm,
is
Bush. Yeah.
that has also a meaning. So this is like perfect for your mouth
Mm.
to have a very relaxed, open mouth and jaw,
Ja. Mhm, mhm.
jaw, yeah, relaxed jaw muscles,
Mm.
and to have that relaxed Wangen,
Cheeks.
cheek,
Wangen. Mhm.
cheek.
Right.
And you don't have to do like with a straw, which is like static.
Mhm.
It can be like, look, I'm in
Right.
that position. I don't feel that great. And when I can use that flexible tube,
Mm. Right. More movement. Yeah.
I have no movement, right?
Yeah.
Yes. It's very relaxing, yes. And it just also brings your larynx into that lower position. And you have that different sound, that bubble sound, which you can, yeah, just enjoy. And you don't, ooh, where you think, oh, how does it sound? Is it like this, like this? Is it how I expect it to be? No, there's that unexpectation. I think
Yeah.
that,
Yeah.
yeah, just a strange sound that can relax your voice.
Right. And it's really about the sensation as well of allowing this to happen. Because what I try and tell people as well is that the minute we open our mouths and phonate and allow sound to come out, it takes a long time for it to go out and get back to your ear.
Yeah, yeah,
And there's also a big question about this, about the larynx and the ear
yeah,
connection. But
yeah.
I try, and this is what I try and do with the SOFTs and the straw and the lax vox, is to allow them to feel the sensation of the note inside without hearing it too much. You're kind of
Mhm.
using your inner ear to hear
Yeah,
it,
yeah, right.
which
This
is
is, yeah,
yeah, it's another type of way to be comfortable with the sound.
yes, right. That's
Yeah.
right. And it's very mm, it's not dangerous, it's
Right.
not a dangerous
Yeah.
exercise. Yeah,
Yeah,
it's
it's very
for
healthy.
everyone. It's
Yeah.
very healthy.
Yeah.
And you can use it as a warm up. You can use it while it's training, and you can use it as a cool down. So
Yeah.
it's for every part of your lesson, or even when you're performing, you can have this at backstage or even on stage and do it
Yeah.
if
Yeah.
it's necessary. Yeah.
Absolutely. On the train,
Yeah, right.
when you're on your way to a gig or somewhere. For sure.
Yeah, yeah.
Yeah. Excellent, Lucy. Actually, I just thought I just had to look up the Durchmesser. Is actually not
Yeah.
circumference, it's diameter. And I really want to say that because I know that Katia, my girlfriend, will be watching, and I'll say, yeah, it's circumference. And she'll be watching going, no, it's not.
Okay. Okay, you
diameter
got the right word.
of the vocal tube, or the LAX VOX. Great, Lucy, this has been so good. I've really enjoyed this.
Really? Oh, me too.
Yeah, it's been so informative. And again, speaking in your non-mother tongue, I think it was great, and also everything was understandable. And I think that these kind of interviews, or these kind of discussions talking about the benefit of knowing a bit more than just your scales for teachers and vocal coaches, and for me, is very, very important, and very, very, yeah, I'm very grateful.
Yeah, that's cool. Yeah, thank you. Yeah, I
So
hope we can speak about that later, like in real and in one room, not
yeah,
here.
that would be nice, actually. Yeah, yeah. I'm
Here in
also,
one city, actually.
yeah, I'm, yeah, exactly. I'm moving to Vienna in October.
Oh no, okay.
Yeah, so I'm moving to study jazz vocals in the University of Vienna, MUK, Musik und Kunst Universität Wien.
Cool.
So
Cool.
I'll be
That's great.
moving away, so we'll definitely have to meet before and talk about this in person
Yeah,
as well. Yeah, exactly. Over
yeah,
a coffee.
yeah.
That'd be nice.
Okay,
Yeah.
good.
Yeah. Great,
Yeah,
Lucy. Thanks so much again.
yeah. No, thanks. You're welcome.
Yeah, right. Yeah, I know, nicht davor, right? And this is what in German is nicht davor, but we kind of, in English, we don't necessarily say that, but maybe we say no thanks needed or something like that.
Okay, no, thanks.
Okay, excellent. I'm just going to stop record here, and then we can just have a small chat after, okay?
Okay.
Cool. Bye bye.